It is frightening to hear you have cancer. And if you do get that diagnosis, it can be life-saving to see doctors providing cutting-edge comprehensive cancer care. Here to explain the risk factors and treatment options of lung cancer are doctors Puneet Bhalla and Dr. Mark Ono. They are both from Ironwood Cancer Research Centers. Great to have both of you here. What are the risk factors associated with lung cancer? Are they still the same?
Good morning, Susan. There are about 220,000 new cases of lung cancer every year and about 160,000 deaths attributed to it. 90% of those are directly related to tobacco abuse. About 10 to 15% are others, and including that would be prior history of radiation exposure, asbestos exposure, HIV, lung fibrosis.
And do you have to be a smoker to get lung cancer? Are non-smokers also at risk?
A very good point. So over the past 10, 15 years, we've seen a rise in incidence of non-smoking related cancer incidences. So about 10 to 15% of cancers now are in non-smokers.
And that could be what? That secondhand smoke or just some of the other factors that you were talking about?
Unrelated to tobacco, completely unrelated.
Interesting, interesting. Dr. Ono, I want to ask you, what are the symptoms that someone should look for? Are they going to feel a certain way if they start developing lung cancer?
So a lot of patients don't have any symptoms when they first present, but once the tumor gets bigger, they can present with things such as coughing, shortness of breath. Occasionally they can cough up some blood, have some chest pain.
How do you screen for it?
So patients that have high risk factors, if they've smoked a long time, they have family histories of that, often followed by either chest x-rays or CT scans. The important thing is that they should talk to their primary care doctor and talk about their symptoms and make sure that they get seen.
Yeah, you said coughing. What about weight? Does that have anything to do with it at all?
So any unexplained weight loss should be evaluated, but again, It's important to see your primary care doctor and follow up on that.
So what are the treatment options? Oh, go ahead.
So I just wanted to add to what Mark was saying. About 4 or 5 years ago, there was a trial published that looked at CT scans, low-dose CTs, and I would encourage all smokers who have a history of more than 15-pack year to 20-pack year history of smoking to talk to their primary care physicians, enrolling in that, because there's a 20% reduction in risk of mortality associated with screening for lung cancer, so detecting cancers early.
So once you get that diagnosis, what are the treatment options available?
So typically surgery, radiation therapy, and chemotherapy are the main options. It all depends upon what stage you're presented and so forth. And usually it's important that you see a team effort with a surgeon, a radiation oncologist, and a medical oncologist.
What are you guys doing differently out at Ironwood Cancer and Research Center? Are you doing anything differently? I know that you said you were doing a lot of testing.
We have clinical trials available. So what a clinical trial is patients who meet certain criteria, whose disease has progressed. So we look at drugs that aren't available, that are not FDA approved, that we think are better than existing therapy options.
And I know that you were saying, we get that diagnosis. It's terrifying. You want to start getting treatment. What is the success rate? I mean, does it matter if you're stage 1 or stage 4? Obviously, the earlier the better. But what is the success rate at any stage?
It does. So in stage 1 patients, about 70% of those can expect to be cured with surgery. Depending on other characteristics of the size of the tumor in stage 1 and stage 2 tumors, for most of them, we recommend adjuvant therapy too. Adjuvant therapy would be chemotherapy. What we factor in is the comorbidities that a patient has, so what other health-related conditions. Do they have cardiac disease? Do they have kidney issues? And how functionally active they are. So if you think of a cancer, think of it as a tree. You remove the tree, but there's a small chance that the tree has flicked off seeds. Those seeds could be lodged in the other lung, in the liver, in the bones. The idea behind chemotherapy is to kill those seeds.
Right, and do it quickly and get that testing. 1 in 4 was what we were saying. That's an alarming number. Thank you both. Great information. We appreciate you being here. Ironwood Cancer Research, Ironwood Cancer and Research Centers. They have 9 Valley locations. To book an appointment today, call 480-821-2838, or you can visit their website, ironwoodcrc.com.